Hello friends, and hello Mbak Nisa. We will presentation about the response of the Indonesian people to the COVID-19 vaccine. We from group 4. Before that, I will introduce my group. Number 1, Nafa Sastria, Muchamad Aflakhul Anam, Dedi Ramadhan, Muchamad Rifqi Sofa, Noufal Falah, Micha Ericko, Prihatiningsih Rafli, Almasah Tsabitah, and the last Sheila Ramadhani. I think it's time, my friends, to explain the presentation. Please start the presentation.
Okay, we talk about COVID-19. As of December 31, 2019, there were 27 reported cases of pneumonia in Wuhan City, Hubei province in China. These patients mainly have clinical symptoms of dry cough, dyspnea, fever, pulmonary infection, and all of these cases relate to seafood market located in Huanan, Wuhan City, which sell various species of live animals including poultry, bats, guinea pigs, and snakes. And next, on February 11, 2020, WHO officially called the disease triggered by 2019 nCoV as coronavirus disease 2019 or COVID-19. The spread of COVID-19 then continued rapidly until many countries were infected with COVID-19. Until January 30, 2020, WHO declared the COVID-19 outbreak in China a public health emergency of international concern, or PHEIC, COVID-19 as a global threat to the world. Okay, next.
On 2 March 2020, for the first time, the government announcement two cases of positive COVID-19 patient in Indonesia. However, University of Indonesia UI epidemiologist Panduryono said the SARS-CoV-2 coronavirus as the case of COVID-19 had entered Indonesia since early January.
Okay, now is my turn to explain about COVID-19. However, the identification of the first case in early March was a local transmission and not an important case. The entry of the virus is very likely to occur through cats in several parts of Indonesia. Since January, when this new type of coronavirus was announced can be transmitted between humans and was colonized virus countries other than Wuhan in China. Thank you.
COVID-19 can pass with immunization and vaccine. What is immunization? Immunization is effort to build and increase adult or child immunity against the disease. Immunization is to prevent certain disease or to avoid the risk of developing severe symptoms when a disease occurs. One form of immunization is by giving vaccines. Vaccine is the antigen or foreign object that is inserted into the body to produce an immune reaction against certain disease. Vaccine usually contain microorganisms such as virus or bacteria that are dead or alive but weakened. Vaccine can also contain parts of microorganisms that can stimulate the immune system to recognize this microorganism. Thank you. Next.
There are 3 steps that need to be considered in the plan to carry out mass vaccination in 2021. The steps taken by government to ensure development of COVID-19 vaccine. Vaccine distribution in this step to conduct studies in humans with a sample size of 100 to 500 people. Second step is safety after research to pass clinical trial. To enter step 3, they need a sample of 1,000 to 5,000 people will be tested to ensure safety, effectiveness, benefit, outweigh the risk of use in the large population. And if the 3 clinical complete and the results are satisfactory, it will enter the approval phase.
Hi, so this time I will tell you about research availability of the COVID-19 vaccine. The following are the steps taken by the government to ensure vaccine development and production. Number 1, supervision of vaccine distribution. Number 2, vaccine quality control. Number 3, supervision of drug safety after marketing. And so my explainer will explain in more detail about vaccine. Thank you.
Okay, I will giving you information about the stock vaccine until 2022. The total vaccine prepared by the government until 2022 reached 371 million doses of vaccine. And in the 2020, a total of 275 million doses of vaccine. In the 2022, for a total of 87 million doses of vaccine. And that is a fact for vaccines in the 2022, Indonesian government orders to Sinovac and Covax approximately 87 million. And there is a vaccine details in 2020, and the number 1 is 116 million doses of Sinovac vaccine, and the number 2 is 52 million doses of vaccine from Novavax or pharmacy from the United States. And number 3 is 45 million Pfizer vaccine, and the number 4, 12 million doses of Covax vaccine, and the last is 50 million doses of AstraZeneca vaccine. Thank you. Next.
Any 6 types of COVID-19 vaccine. The first is from PT Bio Farma, the second is from AstraZeneca, the third is from China National Pharmaceutical Group Corporation, the fourth is from Moderna, the fifth is from Pfizer and BioNTech, and the last is from Sinovac Biotech.
Vaccine delivery scheme. The vaccine, the program designed by President Jokowi January 2021. How this service the vaccinity patients consults, puskesmas and the hospital. Registration via the application. Okay, thank you very much and stay safe and healthy.
Thank you, my friends. I will explain the conclusion of this presentation. The conclusion that can be drawn from the research, the response of the Indonesian people to the COVID-19 vaccine are as follow. Number 1, based on the results and the discussion of the study, it can be concluded that vaccine education is very important to determine the impact of its use. Number 2, vaccine training and knowledge are needed so that the community will be sure to support the government efforts with a vaccination program. Okay, Good job, good work, my friend. I think that's all. I hope this presentation can be useful, and goodbye.